Hi everybody, I'd like to discuss what a rhinoplasty specialist is. This is a term that you don't really find so much in the actual medical boards, but it's a term describing somebody's practice. There's a handful of us around the country and around the world, and typically we're either facial plastic surgeons or plastic surgeons. And the difference is facial plastic surgeons come from the head and neck surgery route and then do a facial plastic surgery fellowship where we concentrate exclusively on the face. And the plastic surgeons typically come from the general surgery route and do fellowships and residencies focusing on the plastic surgery of the entire body. But a select number of such surgeons decide to dedicate their majority of their practice to one surgery, and that's rhinoplasty. And the reason is rhinoplasty is the most complex of all surgeries. So a handful of us, and typically there's maybe one, perhaps two per major city, but there's just not that many of us. And we've chosen to really dedicate a large part of our practice to this one humbling, complex, involved operation. Names like Dean Toriumi, Russ Kreidel, Norm Pastoric, Jack Gunter, Sheen. There's a number of plastic surgeons and facial plastic surgeons around the country that really have dedicated their lives to this one surgery. In the Washington, D.C. area, Northern Virginia, Chevy Chase, Bethesda, Maryland, and the Washington, D.C. area, I came here about 10 years ago and decided this is what I was going to do. And my practice surgically is practically 100% rhinoplasty. I don't do really any other plastic surgeries, and I've focused my entire practice to this one operation. Now, my partner, Dr. Kulak, is a face specialist. She does facelifts, eyelid surgery, and lasers and lip surgery, etc. on the face. If a patient, for example, needs a chin augmentation and a rhinoplasty, we combine it together. There's also a handful of very specialized plastic surgeons in the greater DC area that focus exclusively on the body. And what we do is if a patient needs breast augmentation, a tummy tuck, or a liposuction combined with rhinoplasty, they'll get best of all worlds. They'll get a specialist in each field. There are a handful of plastic surgeons that do everything from top to bottom, and they do a decent job on most things. But I think you would agree it's really hard to be excellent at everything. As a rhinoplasty specialist, it doesn't mean that we get perfect results every single time. Perfect symmetry, perfect smoothness is almost impossible most of the time. But what we don't do is we don't destroy noses. It's extremely easy to destroy noses. Looking at people like Michael Jackson, LaToya Jackson, and the number of people, relatives, friends, people at the supermarket, people at the restaurant, where you see really bad nose jobs that scare a lot of patients out of getting a nice, good, natural nose job of their own, really shows how easy it is to destroy a nose. The American Society of Plastic Surgeons shows that the average plastic surgeon does about 12 rhinoplasties per year. In some of our practices as rhinoplasty specialists, 2, 4, 6, 8, 10, or 12 a week is not that rare. So do your homework, choose carefully.